Hello everyone, welcome to the M3 Academy. MCQ meets mnemonics. Yes, please comment about the audio visual so we can start the session. Yes, our current session is about the INICT. For the upcoming INICT, we will discuss the strategy, important subjects, time management, and many more. Yes, so please comment about the audio visual so we can start the session. Yes, shall we start the session? Is the audio is good? Yes, shall we start this? Yes, so this session about the INICT, some strategy and some important points. Yes, if many points you already know. Yes, maybe you know many points. So please take this session as a checklist. Yes, you can check out which things you not know and you can add. Yes. So the first thing for the yes, welcome to Dr. Rahul in the session. Yes. So what you think you become. Yes, what you feel you attract, what you imagine you create. The first thing started with the belief. Yes, you can, you will be, you can the INICT aspirant. Yes, first thing you start believing. If you not believing yourself, you can crack the INICT, nothing will happen. Yes, nobody help you, no plan, no subscription, no academy, no faculty will help you if you not believe yourself that you can crack the INICT. Yes, first thing is start believing yourself. If you start believing yourself, if you are thinking like the INI aspirant, if you are thinking like the INI ranker, and if you are thinking like yourself, if you are visualize yourself as the INI CTM's resident in your dream branch, then you obviously attracted those things that important for INI CT. Yes. So shall we start the session? Yes. So yes, so why should target INICT? Yes, obviously INICT is earlier than the NEET PG. So this is our first exam before the NEET. So we can take as it as a GT. Yes, as it is the best practice test. Now INICT itself has a different importance. This is central level institute exam. Yes, obviously you will become the resident in the National Institute exam. Yes, national importance of the institute. Also include AIMS and JIPMER and NIMHANS. Yes, so all the premier institute. If you are doing residency there, you will get a better and more appropriate exposure. Yes, so yes, why you should target INICT? Obviously, the number of seats are increases because number of the AIMs are opened more. Yes, and many more central level institute are taking part in the INICT. Obviously, chronologically, this is first exam, then the NEET. So obviously, if you appear in this INICT, you can check your preparation or you can boost your confidence. You can familiar with the exam pattern. Yes, and even if you are not prepared, yes, you should appear. Yes, you should appear. Yes, so now, so why should we target INICT? Obviously, INICT first thing is a central level exam. Yes, we will get the exposure to better and most modern equipment and the diagnostic opportunity in these institutes. Obviously, the exam purpose, the seats is increased, and the most important, the exam pattern. Yes, in this INICT, the previous year topics and previous year question are very much repeated. Yes, topic is same for the NEET and INI, but in INICT, the topic is very much repeated and topic asks in the depth. Yes, in INICT, the examiner asks topic in the depth. Yes, so selected topic in the depth. Yes, so if you are reading selected topic in the depth and keep reading, keep revising them, you will crack this INCT. Yes. So first thing is start believing in possibility. Yes, you can crack this exam. You will be ranker of this INCT and trust your process. Now, So what is the first step of the cracking any examination? First step to analyze the structure of the exam. If you don't know how the question are asking, then the all matter all the off. Yes. So first thing, analyze the structure of the exam. Obviously, last time at the end point that changed the pattern of the examination. So obviously, familiarity with the examination is very important thing. Then you start the smart study after analyzing the exam pattern. Then we can make the strategy. Yes, so as you know, the recent pattern may be changed, but I am talking about the last pattern. There is a four set, yes, four set 50-50 questions, and if you attempted one set, you will not come back to that set. So please please less mark for the review. So mark for the review जो क्वेश्चन है वो आपको कम से कम रखने हैं. यहाँ पे सबसे इम्पोर्टेंट चीज आ जाती है टाइम मैनेजमेंट की. ऑब्वियसली वी विल discussing the time management, how we can do the better time management. So what is the moral of the story for the INICT? You have to read less but the study more. Yes, what is the this meaning of this sentence? As I already say, INICT examiner are asking common topics. Yes, selected topics in the depth. They are asking selected topic in the depth. Yes, so you have to read less and study more. Yes, you have to read A to Z that topics from your notes, from your standard books. Yes, so read less and study more. Yes, read selected and get selected in exam. If you are reading selected in the depth, you will get selected in the INICT exam. Topic and Neetpg, INICT, even FMG is similar, but the weightage of the topic, but the depth of the topic, but the pattern of the asking of the question is different. Yes, in INICT, many question is about sequential arrangement. Yes, so you have to know every step of this that procedure, every step of that part. Yes, if you not know, if you miss anything, you will not answer properly. Yes, so there are various pattern of the question, like the sequential arrangement is there, true false is there. Yes, yes, or they can ask like they are given the four sentences and they are asking how many are correct. So you should know the every option, then you can tell how many are correct. So you understood the meaning of this examination. They are asking in the depth. Obviously, they are taking the topic selected. They are common topic in your ward and your hospitals. Yes, the common procedures, but they are asking in the depth. Obviously, we are reading. Yes, so we should read less and study more. Yes, in the depth. Yes, so there are various pattern of the question, like multiple completion type and sequential arrangement type, match of the following type. Yes, now so how we do revision? Yes, how we do better revision for this examination? So you can say you can follow the strategy of the retrograde revision. Yes, what is this retrograde revision? That how we can do selective reading. Yes, how we can do selective reading. So you can follow this retrograde revision. Yes, so you can make a time schedule. You can make it your timetable. Yes, we already following the magic schedule. You can add in the group of the magic schedule. Yes, so you can start with the PYQ test or the modules. Yes, with the INICT tag, or you can add the tag of the clinical recent trends. Yes, and the instrument. Yes, so instrument and IBQ are very much asked in the INICT, so you can add in your custom module. Yes, obviously INICT the tag is AMS, and obviously you can add the tag of the instrument and the recent advances. Yes, instrument and recent advances, or you can include the clinicals. Yes, so you can start from the PYQ test from the subject schedule you will following. Yes, so when you solve module in the exam mode, obviously you should solve the module in the exam mode, then review that module and get back to your notes, then the chapters, then the subtopic of that chapter, and study that chapter in the depth. Yes, study that subtopic in the depth. Yes, so PYQ from the last 3 year you must do. If you have time, you can go to last 5 year. If you have more time, you can do the last 10 year, but at least last 3 year PYQ. Yes, because the exam pattern is keep changing, but topic is the same. Obviously, NICT conducted 2 times, so in the 3 year there are so many questions are there. There are so many topics. So if you are doing last 3 year, because just doing question is not sufficient, just knowing the answer is not sufficient. Obviously, as it is question also repeated, but the important is the topics. Yes, if you found any topic from the PYQ, you have to do in the depth. Yes, so it takes time. Yes. So how we follow the retrograde revision? Yes, for the selective reading, we do a PYQ test or custom module with INICT tag, or you can include the instrument on clinical. Yes, and the recent update. Then we review the test. Then we get back to our subject notes and subtopic, and we will study in the depth. Obviously, we are filtering the content by this way. Yes, obviously we are filtering the content for the last 10 days revision. Yes, so who can tell you what should you revise in last 10 days? अपने को कौन बताएगा कि last 10 days में क्या revise करना है? Yes, so this PYQ module tell us what should we revise in the last 10 days. If you mark any question wrong, if you are keep doing that question wrong in each and every GT, yes, each and every GT, then obviously you can capture the photograph of that pages. Obviously, you can capture the photograph of that pages, and with caption you can upload yourself in the Telegram group. Yes, you can make the private channel or group with yourself, and you can upload this pictures. Yes, so you can revise that easily, or you can make the image folder in your book, and you can bookmark that MCQs. Obviously, you can write in the your 20th notebook. Yes, so you can filtering content for last 20 days. Yes, and obviously only take the volatile or forgettable topics that you are keep you keep doing mistake in every ZT, every PYQ test. Yes, so also you can mark the page numbers in the first page like this notes. Yes, like this your notes of any subject. So on the first page, on the first page you can open the first page, and you can write the page numbers of that chapters, page numbers of that topics that you mark wrong, or you will revise in last 10 days. You how you can do for how you can do. Yes, how we can make the last 10 days content. Yes, how we can filter. You can add in the 28th notebook. Obviously, you can bookmark the question as a star mark. Yes, and take a volatile forgettables photo and categorize in image folder in phone or your own private Telegram group of ch or channels with the caption. Yes, so what is the what is the use of this feature of the Telegram? If you are uploading that forgettable image with your own Telegram group in the or your own private Telegram group, you will easily find out later. Yes, by typing the search option, you easily get the topics. Yes, and this can you can access anywhere. Yes, and write you can write the page numbers of that forgettable pages on the first page of the notes. You can fold that pages. Yes, you can fold that pages. So for the letter revision, yes, you can fold that pages like this, and you can use the different color code highlighter. Yes, red color for the most volatile and most important. Yes, green color board for just the second reading. You can make the color code. Now what the timeline we should follow? कौन सी timeline को अपन यहाँ पे follow करेंगे? Yes, if you are starting for INICT from now, yes, if you want to start a fresh revision cycle, so you should follow this preparation phase, then revision phase, then the final phase. Obviously in the preparation phase we have three types of the subject. In the preparation phase you can give the 30 days. If you are starting from today, then 23rd to you can 22 of the next month. Yes, so there are three type of the subject: rank developing, rank building, rank amplifying, and rank decisive. Yes, so rank building. So obviously first and second prop subject with integration with clinical subject and ENT orthopeds are the rank building subject. Yes, so NHAT examiner are asking more question from the pre and paraclinical subject with the integration of the clinical subjects. Yes, so these subjects are the rank building subject. Now rank amplifying subject, if you do that subject thoroughly, your rank is boosted up like the PSM, surgery, OBG, and medicine. Obviously, short subject are rank deciding. There in the short subject the name is short, but subject is not short. If you are reading the Dharma from A to Z, you will you can study the whole year in the dermatology, but you have to be selective. So short subject are rank deciding. You have to go selective in the short subject. Yes. So if you are taking derma, you should start from the vesicobular disorder, then you go to the STD, then you go to the general anatomy of the skin, then you go to the rest of the chapter from the important subject. If you are going to the infection, you take the herpes zoster first. यस लेप्रोसी फर्स्ट, यस तीनिया फर्स्ट. सो इस तरीके से अपन यहाँ पे शॉर्ट सब्जेक्ट में चल सकते हैं. यस. Now, so this is the preparation phase. Next phase is the revision phase. You can allot 15 days for the revision. Yes, and final phase is the, yes, last 7 days of the revision. Yes, but if I am telling you this is revision phase, so do not make your revision just postpone. Yes, you will do simultaneous revision. You have to do simultaneous revision. Yes, so you can take the revision hour diary daily. You can allot 1 to 2 hour for the revision. रोज का 1 से 2 घंटा निकालना है, अलग से डायरी बनानी है, उसमें लिखते चलना है आपको कि आज का आपने क्या रिवाइज किया. यस, जस्ट आपको यहाँ पे डेट लिखनी है और सब्जेक्ट लिखना है, आज आपने क्या पढ़ा और क्या रिवाइज किया. सो the purpose of this, you can do space revision. What you revise today, you have to revise on the day 3rd, on day 7, on day 13. Yes, so you can make the revision hour diary. Yes, so we have to do simultaneous revision. Yes, now subject wise approach. Yes, so I'm taking as a anatomy as an example. Yes, if you are starting the anatomy, do not start from the first chapter. Please start anatomy from the higher weightage chapter and the most difficult chapter. Yes, and how you identify the higher weightage chapter by the previous year question and previous year modules. Yes, so this is the question of the INCT 2023. Yes, and obviously you can see the in the INICT, just recent INICT, there are many questions from the CNS and the head and neck. Yes, CNS and head and neck, and very less question from the embryology and histology. So you can see in the this question cerebrum from the head and neck, cerebrum lobe from the head and neck, neural crest derivative. Then you can say cranial nerve, basal ganglia, fornix, facial nerve, glossopharyngeal nerve. Yes. Now the trigeminal nerve is there. So there are so many questions from the head and neck and neuroanatomy. So yeah, so we should start our revision from the difficult chapter and most important, most repeated chapter. Yes, if you are starting the anatomy, you should start from the CNS or head and neck because this is most difficult to remember and most scoring the examination. If you are starting from the easy topic and less scoring topic, obviously you will tired in next 2 to 3 hours, and when you go to the most volatile, most difficult topic, your brain energy level become decreases, you exhaust it. So your capturing power, your attention power, your focusing powers is decreased. Obviously your performance on that important topic, that volatile, that difficult topic is decreases. So please take the difficult volatile topic initially in the your revision. If you are starting any subject of the revision, please start from the most difficult, most volatile and most scoring chapters. Yes, if you are starting from the dermatology, start from the vesicobular disorder. Yes, even if it is difficult, you have to start from this because if you are starting from the easy, your whole energy going to involved, and when you go to that difficult topic, your brain energy, attention, focus, concentration is decreases, so your performance, your ability to recall is decreases. Yes, so you can see now next, so we will see that year wise and topic wise analysis of this. Yes, so this is INICT 2020-22 anatomy. Obviously there is so many question from the CNS. Yes, you can say basal ganglia is repeated, cranial nerve is repeated, this cerebellum is repeated in every year. Yes, this cerebrum, corpus callosum, facial nerve, glossopharyngeal nerve, internal capsule. Yes, you can see neural crest derivatives just repeated in the next year. Yes, so there are so many question repeated trigeminal nerve from the head and neck or the CNS. Yes, so you can identify the most scoring and most difficult subject. Yes, now we are taking the chapter wise analysis, from this subject. So in the anatomy, in the anatomy, the most frequently asked question from the head and neck and neuroanatomy. Yes, in 2017, the phonics. Yes, so everything is phonics about ask in the various years. Yes, they ask phonics. Yes, they ask the fibers. They ask blood supply. They ask the extension of the phonics in each and every years. Yes, so topic is important. Yes, topic is selected by the examiner. Topic is same. Topic is same, but depth is increases. The horizon is increases. Yes, so topic is same is the phonics, but the variety of the question asked from the phonics is different. Yes, they may ask the IBQ, they may ask the clinical, but they have to ask from the phonics only. Yes, this thing have to remember. Yes, now will this video uploaded or only live? Yes, this video is also uploaded if you like this session. Sir, studying topic wise never give satisfaction because a lot of content in the single topic. Yes, you have to consolidate your content. Yes, if you have to consolidate your content and you have to keep reducing the number of the pages of the notes and number of the lines in the notes and number of the keywords in the flashcard. Yes, so if you are keep filtering, keep reducing, and if you are revising, that take the less time and you will feel the completion. And if you are feeling the completion while doing any subject, yes, your confidence level is automatically boosted. Yes, if you are going in the examination, appear in the examination with feel of the completion of the syllabus, obviously your performance is increases. Yes, so topic wise never give the satisfaction. You have to consolidate the topic. You have to make the one page notes for the topic. If you are done with the ECG, please note down the ECG. Please make the small boxes. Please make the small boxes and only write the variable numbers. Yes, hyper, less than, more than, increase, decrease, and keyword and buzzword only. Yes, so you can revise. Yes. Now. So the less is the content, less is the content, less time for the revision. Yes, so more the feeling of the completion. And if you are taking the feeling of the completion, obviously your confidence is more boosted. Yes. Now क्या कह रहे and is the taking lot of time to complete those topics. Yes, you have to manage your times. Yes. So how we can study? Yes. So I will discuss about the speed reading. Speed reading, like you can use your fingers or you can use your pointers. Yes, if I am reading this INICT previous year topic list, so you can read as there 2070s phonics rises from mid sagittal section, lateral pterygoid or function, or you can read with the fingers. Yeah, yes, you can move your fingers on the chapters. You can move your fingers on the lines and your fingers are moving faster than your eyes. Yes, your fingers are moving faster than your eye, and your eyes are following that your fingers. So you can increase your speed. Yes, and you can follow the pointers like you can see in the image in the screen. Yes, I am doing the this दिस कर्सर यस इसको पॉइंटर्स को यहाँ पे चलाता जा रहा हूँ पॉइंटर्स को यहाँ पे चलाता जा रहा हूँ और मैं यहाँ पे पढ़ता जा रहा हूँ यस फोनिक्स राइजेस फ्रॉम द मिड sagittal section of the lateral pterygoid foramen oval. Yes, so this increase our attention, focus and concentration if you are using your fingers for the lines, or you are using the pointers. Yes. Now, sir, are these topic enough for the cracking INICT? Yes, so I already say the INICT is asking the selected topics in the depth. Yes, if you are done with the selected topic in the depth, you already did your 90% for the INICT. INICT pattern is different from the Neetpg pattern. Neetpg is asking everything from the small parts. There is a no depth. Yes, but in INICT the selected topic in the depth, obviously 10% parts maybe new, 10% parts maybe from the other things which are not the previous year topic, but that are not deciding your rank. Your rank are deciding with this fact you are that those topics or question you will not mark wrong that are repeated. Yes, because there are so many aspirant there, because the lot of aspirant are marking that answer right. You should not make the wrong. Yes, if you are doing the mistake in the previous year question or previous year topic, obviously your rank differ in thousand. Yes, and in INICT the numbers of the ranks, yes, the number of the rank very important. In INICT 1000 rank you will not get your desired seat, but in the Neetpg 1000 rank you can get you can get the any seat. Yes, so rank is very important in the INICT. Yes, now so hope your answer is clear, Dr. RK. Yes. So now, so this is the head and neck neuroanatomy 2017. They ask about the fornix. Yes, lateral pterygoid foramen oval. Obviously, we are discussing, already discussed the foramen of the skull in the mnemonic form. Yes, so M3 Academy providing you the super easy mnemonics. Obviously, we are trying to save your effort. Obviously, we are trying to save your effort, your time for the recalling, for the remembering. Yes, so if you found any topic difficult, you can send us the photo. We will make the easier version for you. So your time is saved, your effort is saved. Yes, but you have to do that topic. Yes. So now, so we already discussed the skull foramina and muscle of the mastication is important. Yes, 2018, you can see the Brodmann area, and again this phonics is repeated. So you can see this phonics arises from the mid-sagittal section, and next year this phonics arises from the axial plane. They mention the IBQ. Yes, so you can easily. Yes, in 2020 again the question on the phonics, but this time they ask about the type of the fibers. So I already say the topic is same, the topic is selected, but depth is increases. Yes, so you can see the weightage of the head and neck. There is a yes, कितने क्वेश्चन एक किससे आ रहे हैं? The 1, 2, 3, 4, 5, 6, 7, 8. Yet 8 to 9 question from the single head and neck neuroanatomy. Yes, so this topic has a greater weightage than the other anatomy chapters. Yes, you can see in the 2020 every year more than 8 question from the head and neck. Yes. Now, so 2023, yes, I will share the PDF in the Telegram group. You can see these topics later on. Yes. So now, so what is the order we follow while doing the any subject or anatomy? We should do first head and neck neuroanatomy, then general, then upper limb, then abdomen, then lower limb, then the chest. Yes. So most difficult we take initially. So our most energetic time we expand on the most difficult and most volatile thing, obviously most scoring also. Yes, so what should the custom module take? We already see AMS must be AMS. Yes, then you can include clinical instrument and recent advances. Obviously AMS examiner are asking so many instruments, so many ward procedures, so this tag must be included. Yes, now next is general anatomy. So just joints is very important. Yes, each and every year there is a question on the joint, either in INICT, NEET-PG or FMG. Joint पर एक question मिलेगा. Yes, so we already discussed this joint. Yes, then the ligamentum flavum and collagen, Meissner's corpuscles, reticular fibers, and apocrine gland. Yes, these are the topic from the general anatomy, and you can see there are only one question from the general anatomy, and that are most from the joints, sir. Yes, so you will not mark that टॉपिक रॉन्ग. यस, सो यहाँ पे जॉइंट पे क्वेश्चन है, या फिर आप देख सकते हैं यहाँ पे कोलाजन, या फिर यहाँ पे रिसेप्टर्स पर क्वेश्चन है. नेक्स्ट अपन देखते हैं अपर लिम. सो ओनली 2 or 3 क्वेश्चन फ्रॉम द अपर लिम. यस, मोस्ट ऑफ फ्रॉम द अपर लिम नर्व इंजरीज एंड मसल्स. यस, so you can say ulnar, radial, and median nerve is very much important from anatomy aspect, from orthopedic aspect. Yes, examiner can clinically correlate anatomy to the orthopedic. Yes, so pre and paraclinical subject is important with the integration with clinical subject. Yes, this thing to be important. Now, so you can see the 2 to 3 question from the upper limb. Yes, 1 to 2 question from the lower limb. Next, you can say the thorax, only 1 to 2 question from the thorax, and abdomen, 4 to 5 question from the abdomen. Yes, So which things we to follow in the thorax? Yes. Yes, obviously they can ask the sequential arrangement. What is the arrangement of the structure in the hilar region of the lungs from anterior to posterior? So sequential arrangement of the question are very much favorite for the NICT examiner. So if you found any points, if you found any topic with 2 or 3 point or anterior to posterior, medial to lateral, there may be potential question for the NICT. Yes. So so act like a examiner. Yes, so while doing the theory, while studying the theory, act like a examiner. If you are found anything medial to lateral, anterior to posterior, just steps, yes, flow charts, yes, the steps of the management. This will be your potential new question for the sequential arrangement type of the questions. Yes. Now. So next is embryology. Obviously, 1 to 2 questions from the embryology and histology. The question is very much same about the Purkinje cells, histology, Purkinje cell histology, and apocrine, merocrine, and the holocrine gland histology. And you can say the bronchial and the adrenal gland histology. Now, next. So, what is a smart idea? Yes, so one smart idea you can take the INCT paper are set by the INCT examiner, obviously AIMS examiner, obviously the professor, HODs or faculties of the AIMS, and they already written so many books, so many journals, so many guidelines. Yes, and if you are following that books, that guidelines, their IBQs, their flow charts, yes, you may get advantage because there is a high probability that examiner can repeat from this. Yes. सो स्मार्ट आइडिया यहाँ पे क्या हो सकता है जो भी बुक्स एम्स के प्रोफेसर ने लिखी है जैसे आपको पता है डर्मेटोलॉजी में जो एचओडी है नीना खन्ना उन्होंने उनकी बुक लिखी है उसमें जितनी भी इमेजेस दी हुई है वो आपको की हुई होनी चाहिए वो एज इट इज आ सकती है जैसे मेटोलॉजी में जो एटलस है वहां से ऐसे कैसे क्वेश्चन आ सकते हैं पैथोलॉजी में ऑब्वियसली इमेजेस ऑफ द रोबिन्स एंड हर्शमोन आर इम्पोर्टेंट माइक्रो अनंत नारायणा बट द रिसेंट एडिटर ऑफ द अनंत नारायणा इज द एचओडी ऑफ द एम्स so Anant Narayana images, flowchart, and the life cycle images are important. Now FMT, the Professor R.K. Sharma written the concise textbook of the FMT and question may be repeated. Yes. So this is a smart idea if you follow the resources which are producers by the AIMS faculties or the professors. Yes, now, so certainly emergencies are very important for the INICT. Yes, and obviously not for the AIMS, for the Neetpg and the FMG. Emergencies are very important. Obviously, we are from the medical fraternity and we have to master in the emergency. We have to able to control to manage any emergencies. Yes, so we have made the list for you. Yes, so you have to do emergencies from respective subjects from every subject, either OBG, सर्जरी, मेडिसिन, पीडिया, सबसे इमरजेंसी आपको पढ़नी है. So कौन कौन सा टॉपिक आप पढ़ सकते हो न्यूरोलॉजी में द हेडेक अप्रोच एंड मैनेजमेंट एक्यूट स्ट्रोक मैनेजमेंट एंड कोमा obviously the three type of the hemorrhage extradural subdural and subarachnoid this is the super important topic status epilepticus we already made the mnemonic video on this meningitis encephalitis emergencies increase ICT management, obviously febrile seizure management. In the respiratory system, they can ask the respiratory failure type ARDS management, COPD management, DVT also emergency. Yes, aortic dissection, pneumo, hemo, chylo, tension, pneumothorax. Yes, so each and every year there is a question on this type of the thorax. Now, gastroenterology, you can see the abdominal pain and approach. GI bleed is very much favorite topic intestinal obstruction, intussusception, bile duct injury, classification of the bile duct injury we already covered in the mnemonics. Yes, acute pancreatitis scores in the urology, pelvic fracture, bladder injury, testicular torsion. These topic are the important from the emergencies. Obviously, SELS, BCLS, and BLS are important. Cardiac emergency, bradycardia, bradyarrhythmia, tachyarrhythmia, PSVT management, yes. MI, yes. Asystole, pulseless electrical cardiac activity. Yes, so we already covered the ECG session. You can watch from the M3 Academy. And if you are registered with M3 Academy, you are added in the topic group, you can revise the PDF from there. Yes. Now, shock and resuscitation. Shock is very important. And as per request of our registered member, Dr. Manmohan, we already took the session. on the shock. Now, emergency assessment like the trial GCS, yes, GCS is very important. Head injury and management of the different type of the traumas. Yes, burn is very important, and the burn, the formula of the burn adults and the childrens. Yes, we already made the mnemonic session for the Browder's formula. Now, spinal cord compression, snake bite, scorpion sting is very important. Yes, even they can ask about the ASV, then they can ask about the drugs, neostigmine and the atropine, orbital blowout fracture. Yes, teardrop sign they can ask in the radiology, ENT, facial trauma, the facial trauma classification, epistaxis management. Yes, this question asked repeatedly, which artery not part in the little's area or the एपिस्टेक्सिस यस सो इसमें जो किसेल बैक प्लेक्सस बनता है उसमें कौन सी आर्टरी पार्ट नहीं लेती है ये पूछा हुआ है रेटिनल डिटैचमेंट विट्रस हेमरेज यस यस ईयर ट्रोमा ईडी यस ईटीडीआरएस स्टडी नाउ टेम्परेचर रेगुलेशन यस यहाँ पे एक चीज पूछते हैं स्वेटिंग कहाँ पे नहीं दिखती है तो आप कमेंट सेक्शन में आंसर कर सकते हैं we already took the session on the psychiatric emergencies. You can revise allergic reaction like anaphylactic shock, adrenaline dose in the anaphylactic shock, thyroid storm. Yes, in dermatology, the toxic epidermal necrolysis is the emergency. Is a toxic epidermal necrolysis has a higher mortality rate. Yes, so you have to master in this. Now, neurolapse malignant syndrome, anticholinergic syndrome. In obstetric, you can see the PPH, cord prolapse, uterine rupture, obstetric labor, and eclampsia. Yes, so the important thing is they can derive the sequential arrangement type the question. They can ask the correct steps of the management. So we have to do the steps of the management in the very much correct order. Yes. Now medical procedures like Foley's catheterization. They can ask the color code. Yes. Obviously flow rate. Oh, yes. Now, rise tube feeding, ICD feeding. Yes. Now, emergency drugs is very important. Dopamine, noradrenaline, atropine. Yes. So, this drug we have to know about which receptor it act, what is the dose for the emergency management, what is the route, which drug are given by the endotracheal route. Yes. And what is the other route, other side effect of these drugs. Yes. Now, delivery devices, they can ask oxygen delivery devices. This question also repeated in the Neetpg. Yes, what is the FiO2? What is the percent of the oxygen delivered, and what is the image? Yes, and they can also ask the mode of the ventilator and the delivery devices. Now the blood transfusion they can ask. Blood transfusion, obviously hematology is very much important for the INCT, even for the NEET PG. Yes, whole pathology is one side, whole hematology is one side. Hematology is a 50%, more than 50% weightage because it cover the subject from the medicine also, from the pathology also, and from the other subject also. So hematology also important, and we already conducted the mnemonic session on the blood transfusion, hairy cell leukemia, yes, on the translocation, chromosome, सब पे सेशन बनाया हुआ है जो भी आप ढूंढते रहते हैं वो सब हमने पहले से ही कवर किया हुआ है. Yes, all those topic you are searching for the mnemonics we already covered in our syllabus. Yes. Now next. So disaster management from the PSM, yes, at the PHC level, important drug given at the mass level. This thing is important. So this is a list of the common emergencies they asked previously in the INICT, and we have prepared the list for you. You can take the screenshot or you can download this PDF from our Telegram group and keep studying that topic from your notes with the correct steps of the management. They can derive the question like the sequential arrangement. Yes, now. So next thing is what about the first aid? Yes, if you have any question about the first aid. Yes, yes. So if you are starting from now the first aid, then you can avoid this first aid. Yes, and if you are already doing the first aid, you can do the first aid. Yes, so not to first aid if you haven't started previously, but because the time is less, obviously, if you are doing anything from now, you have to revise. Yes, if you not having time to revise minimum 5 times, the material is going to the waste. Yes, so You can allot your 1 hour for the first aid. Obviously, first aid is a very consolidated material, and first aid good for the biochemistry, pharmacology, and the psychiatry. Yes, if you studying the antiplatelet drug, you can see the flow. You can see the schematic diagram of the first aid. Yeah, the first aid. Yes, they have written the total drugs in the simple, easy diagram in the flow chart. Yes. सो द क्वेश्चन जो भी क्वेश्चन आते हैं जो भी इस तरह के क्वेश्चंस आते हैं कि जिन पे वो पूछते हैं सिक्वेंशियल अरेंजमेंट ट्रू फॉल्स वो यहाँ से आपके सही हो सकते हैं यस नाउ सो आगे बढ़े इज ऑडियो इज गुड सो yes. So how many should attempt in the GTs and the main exam? Yes. So many toppers say they have aggressive. Yes, aggressive in the attempting. Yes. So in the NICT, obviously, we have to score more. Yes. Obviously, the 1000 rank is equal to the 10,000. Yes, 10,000 rank of the NEET PG is equal to the 1000 rank of the NICT. Yes. So you should have the single digit or the double digit rank for the your dream branch. Yes. So how many attempts you must be aggressive at least 180 to 185. You if you can rule out two option, you must attempt that question. Yes. If you are clueless about the four option, you can leave. Yes. So obviously there's a various pattern of the question, sequential arrangement, true, false, yes, IBQ, multiple matching type questions. So these questions are taking so much time, so much time. So we have to practice the time management. So for the time management, you can do 300 question GT in the 200 GT time. Yes, so you can improve your time. Obviously, you can expand your visual areas while reading the question. You can use the pointers for the increasing your speed. Yes, and you can make the correct posture while attempting the GTs. Yes, if you are not making your correct posture, your attention, focus, concentration may not be at the proper level that required for the appearing the GTs. Yes, now next. So how to avoid anxiety? Yes. So if you are keeping your syllabus less, if you are keeping your study material less, if you have the consolidated material, you can revise easily in the less time. And if you revise your content, your material in less time, you have you can develop the feeling of the completeness, and this feeling of the completing the syllabus giving you a confidence that confidence is required to overcome your anxiety. Yes, so you have to keep limiting your syllabus, keep filtering the content, and if your content is limited, your content is filtered, your content in the one page, you easily complete that syllabus and you feel the completeness. Obviously, this give confidence and this reduces the anxiety. Obviously, this anxiety you can overcome by the continuous attempting of the practicing of the questions. Yes, now next. So last days, what you can do in the last days of the examination, obviously you can attempt the NICT pattern GT. Yes, you no need to look at the rank, just attempt. Yes, just on the GT, just keep attempting the questions in the last days of the examination. Yes, so attempting the NICT pattern GT or NICT recall GTs. Yes, so this is important for the generating a momentum. Yes, so this momentum is very important. If you have generated the momentum in the last time, how the question is asked, what is the pattern of the examination, what is the environment of the examination, what is the environment of the questions and the scenarios. Yes, obviously, if you are going with this momentum in the examination, the exam is just like your next GTs. Yes, so you not need to see the ranks because you already doing the previous year question, previous year topic, so you already know that topics very well. We will attempting this NICT pattern GT in the last time for generating the momentum, for increasing our attention, focus, concentration, time limiting, time management, and the sitting capacity and familiarity with the environment and reducing the anxiety. Yeah. So our exam is the just like the next GT. Yes, obviously you are looking at the rank, you may be demotivated with the less ranks. Yes. Now. So next thing is what is the plan for the last 10 days revision? Yes, obviously last 10 days you have to put the long study hours. So please keep the small breaks between the long study hours. Obviously you have to normalize your sleep cycle because memory consolidation occur in the sleep. If your sleep is proper, your memory is proper. Your memory is proper in examination, your ability to recalling, reproducing is proper. Yes, everybody reading the same sources, same material, same content, but result is not same for everyone because the ability of the recall, ability to reproduce in examination is different. That come by the attention, focus, concentration, and our recall power. Recall power developed by our good habits of the sleep, good habit of the eating, yes, good habit of the schedules, and avoiding the negative thoughts. Yes. So now last 10 days you have to revise your consolidated content, your bookmark content. Yes. So what is the purpose of the study in the last 10 days? Yes. So everything keep fresh in our memory and vomit in the exam. Yes. So the purpose of the last day is you have to keep everything fresh in your mind and you just vomit in the examination. Yes, if you look anything in the last 10 last 5 days and if this question appear in the examination on the slides of the question, your accuracy speed is very much higher compared to the earlier. Yes. Now, so no negative thoughts. Obviously you have time for this thought after the appearing of the exam. Yes, after declaring of the results. Now if you are investing your 1 minute in this type of the thoughts, obviously you are losing your 1 minute for the one MCQ, for the 4 marks, for the 1000 rank. Yes, so you can decide yourself. Yes, ये खुद से डिसाइड कर सकते हो कि यदि आप यहाँ पे एक नेगेटिव थॉट में एक क्वेश्चन का टाइम यदि खराब कर रहे हो तो उस एक क्वेश्चन से 4 नंबर से 1000 रैंक आप पीछे जा रहे हो, तो खुद यहाँ पे कंपेयर कर सकते हैं कि आपको कुछ कुछ नेगेटिव सोचना है, कुछ नेगेटिव सोचकर अपना 1 मिनट गायब करना है, या उस 1 मिनट में एक क्वेश्चन पढ़ के 4 मार्क्स लेके 1000 रैंक आगे निकलना है. यस. सो now, so do not read anything new in the last 10 days. Obviously, you have too much for the revision. So you have to revise and focus on the previous year topics. Yes, what is in the last 2 3 days? Obviously, you just keep looking at the notes. Do not read the notes, just glance the notes. Yes, just look at the notes. Yes, if anything appear in the front of your eyes in the last 2 3 days in the examination, the accuracy speed is very much increases, your ability of recall is very much increases. Yes, so do not read, just look at the diagram, flowchart, keyword, what you studied in the previously. साल भर आपने क्या पढ़ा है वो आपको देखना है, फटाफट फटाफट पेज पलट पलट के आपको देखना है कि इसमें क्या पढ़ा है. जैसे ये ब्रेकियल प्लेक्सिस है तो इसमें मैंने 3 नर्व पढ़ी है, इनका कोर्स ये होता है और ये वाला होता है. सो थोड़ा अपना जो पेरिफेरल रीजन होता है उसको थोड़ा एक्सपांड करना पड़ेगा. जैसे आप इस पेज में इतनी सी जगह देख रहे हैं तो आपको इतनी जगह देखना पड़ेगा. यस, यदि ये पेज है और आप आपका एरिया इतना सा है तो आपको इतना बड़ा एरिया देखना पड़ेगा और आपको उसमें फटाफट से देखना पड़ेगा. तो उसके लिए आप फिंगर पॉइंटर वाली टेक्निक यूज में ले सकते हैं. जो भी आप पढ़ रहे हो उस पे फिंगर से चला सकते हैं या पॉइंटर आप उस पे चला सकते हैं. सो इन द लास्ट 2 3 days you have to just look what you studied earlier. Yes, do not read every sentence, every word, just look, just glance. Yes, you have to increase your peripheral vision. You can use your fingers and you can use your pointers for the speed reading. Yes, you can do. Yes. So in the last 2 3 days, you can revise your bookmark. Yes, your volatile, your forgettable, your 28 book, and your saved image folders. Yes. Now, so next thing during the examination, what should be our approach? Yes. So I already say the pattern may be changes. The 50-50 the box पहला वाला जो pattern है. So यदि if you are attempted the 50 set and you will never come back. Yes, ये वापस नहीं आ सकते हैं. So please प्लीज मार्क फॉर रिव्यू लेस. यस, मार्क फॉर रिव्यू वाले चीजें आपको यहाँ पे कम रखनी पड़ेगी. यस, सो इफ यू हैव एनी क्वेश्चन यू कैन आस्क इन द चैट बुक. Yes, so what is the approach for during the examination? So yes, so what is the best approach for the solving the questions? First, read the option. So in the theory exam and MCQ exam, there is a difference in the pattern. In the multiple choice question exam, the answer written in the front of you. Yes, every option is your answer. Yes, so in the multiple choice question based exam, the answer written in your front, but in the theory exam, answer is not written in your front. So you have to understood the strategy of the examiner. The answer is written in your front. So you have to find out answer from your front, not from anywhere, not from the anywhere that you are thinking. Yes. So if the answer is already written in our front or in our screen as in form of the option, so we have to first look at the option. Before reading the question, we have to look at the options. Obviously, we can start reading the option from the fourth to the first. Obviously, the first option is the trap because we are reading the first option and we are marking the first option. We forgot to read the second or third option. Maybe third option is like both A and B. So the silly mistake we can avoid. Yes, so please start reading the option first because option is our answers. Yes, now please start reading from the option first, then third, then second and first, so you will avoid the silly mistake. Now look at the image if the given. Yes, now read the last line of the question and find the twist, like they can ask except. Yes, all are true except. All are true except means they are asking the false again. Yes, so read the last line, then read the second last line. What they ask, they are asking about the diagnosis, investigation of choice, treatment of the choice, procedures, or क्या पूछ रहे हैं. So then you read the last line and second last line. Then take the demography of the question, like HIV or non-HIV, the answer may vary. The pregnancy or non-pregnancy, the answer may vary. The sickle cell or non-sickle cell, the answer may vary. So then to find out the demography of the question, what is the age, what is the gender of the patient, and what is the special status, the pregnancy, HIV, salmonella, ये सब आपके आंसर यहाँ पे बदल सकते हैं, the immunocompromised status, etc. Then find the buzzword and the keyword, like then herpes zoster, find out the unilateral. Yes, if you found the unilateral, painful, acute, group vesicular lesion, then answer automatically the herpes zoster. Yes. So this is the correct approach for the सॉल्विंग द एमसीक्यूज. यस, सो क्या करना है, सबसे पहले ऑप्शन पढ़ने हैं क्योंकि ऑप्शन ही अपने आंसर है. फोर्थ ऑप्शन पहले पढ़ना है, फिर थर्ड, फिर सेकंड एंड फर्स्ट पढ़ना है. उसके बाद क्वेश्चन की लास्ट लाइन पढ़नी है, एक्सेप्ट, नोट, ऑल आर ट्रू एक्सेप्ट, ये वाली चीज आपको पहले देखनी है. उसके बाद सेकंड लास्ट लाइन पढ़नी है, डायग्नोसिस, स्टेटमेंट ऑफ चॉइस, इन्वेस्टिगेशन ऑफ द चॉइस, स्क्रीनिंग, क्या उन्होंने पूछा है. इसके बाद अपने को फर्स्ट लाइन पे आना है कि एज क्या है. एज के अकॉर्डिंग आंसर बदल सकता है. मेनिंजाइटिस यदि लेस देन 1 मंथ पूछा है, 2 ईयर पूछा है ऑर्गेनिज्म, तो आंसर यहाँ पे अलग हो सकता है. या फिर उसके बाद अपने को कीवर्ड वहां से कैच करने हैं, क्या यूनिलेटरल पूछा है, स्क्रीनिंग, डायग्नोस्टिक, यूनिलेटरल, अपर, लोअर, हायर, यस, लेस देन, मोर देन, दीज आर द कीवर्ड कैन चेंज द आंसर्स. यस, और कोई इपोनिम भी यहाँ से आप कैच कर सकते हैं, कोई कीवर्ड भी यहाँ से कैच कर सकते हैं. यस, नाउ, so we already made the magic schedule for you, and many of you are following the magic schedule for the custom modules, and we have completed the 1 or 2 month for this. So यहाँ पे आज क्या है, 23rd है, GIT respiratory and pathology. Hope you are getting benefit for this to maintaining your consistency. So this magic schedule is started for developing the consistency for the aspirants. Yes, you can follow this magic schedule and from the telegram. Yes, now, so we already took the session on the memorizing technique, which memorizing technique we can use for the, yes, obviously mnemonics, graphs, chart, poster, writing is out. Yes, you can teach the someone, discussing with the friends, weird linkage. Yes, and obviously adequate sleep is required. You can make a daily revision hours book. Yes, you can write the date and your revision topics. After the 3 days, you flip the back that pages and revise the topics. Yes, कैन यू प्लीज एक्सप्लेन अगेन. यस, कौन सी चीज एक्सप्लेन करने को कह रहे हैं. यस, विच थिंग यू नीड टू एक्सप्लेन डॉक्टर कंसिस्टेंट. यस, प्लीज कमेंट अगेन, विच थिंग यू वांट टू एक्सप्लेन अगेन. यस, So we already took the session on memorizing technique. You can revise this session from the playlist of the M3 Academy YouTube channel. The playlist name is Cheat Code. Yes, yes. Now. Yes, so this memorizing technique you can use this. You can make the chart on wall. You can use your five senses, like you can speak while reading. You can keep doing the rough work while the reading. Yes, you can convert the theory in the mind map, so you can revise the easier. Yes, you can organize and concise your content. You can quiz yourself. You can ask the question yourself from that topic. Yes. Now. So next is how to keep motivated by the positive affirmation for the higher purpose. If you are making the higher purpose for the higher rank, obviously you will get the motivated. You can visualize yourself as the rankers, as the resident, as the your future. Yes, so you have the clarity of the purpose, what you have to do, why you are doing the session. Obviously, you are attending this session that denote that you are having the enough motivation. Yes, if you are यदि आप ये सेशन अटेंड कर रहे हैं इसका मतलब है कि आप यहाँ पे एग्जाम क्रैक करना चाहते हैं आप एक जो भी फ्यूचर में आप जो बनना चाहते हैं उसके लिए आप यहाँ पे आए हैं यस दिस थिंग इज क्लियर यस सो यू कैन होल्ड योर सेल्फ या आप खुद को पनिशमेंट रिवार्ड भी दे सकते हैं यदि आपने कोई टारगेट पूरा किया तो आप खुद को 100 रुपये दे सकते हैं नहीं किया तो 100 रुपये डिडक्ट कर सकते हैं yes so focus on the immediate goal please make the smaller goals if you are making the last target last goal you will not able to complete because human brain is working on the small targets yes now so next is how to fail in Neetpg. Obviously, how to fail in the I9CT in any exam. If you are doing this mistake, you will fail. Yes, which is this mistake is FOMO. Yes, if you are falling fear of the missing out, ये तो नहीं रह गया, वो तो नहीं रह गया, वहाँ पे क्या पढ़ा रहे हैं, वहाँ पे क्या पढ़ा रहे हैं, तो आप इसी में रह जाओगे. Yes, you have to make your one source and one image for the one topics. Yes. सो यहाँ पे एक टिप्स है यदि आपको कोई इमेज सर्च करनी है इफ यू आर सर्चिंग फॉर द एनी इमेज एनी टॉपिक प्लीज डू स्टॉप फ्रॉम द गूगल प्लीज डू नॉट सर्च फ्रॉम द गूगल सर्च फ्रॉम योर नोट्स यस if you are if you need to find any topic if you are want to know about any topic you just start doing the google please stop this do not start doing google do not start the search on the google any topic yes keep open your notes yes open your notes and find out the topics in your notes in this way your notes is get flipping your notes get open obviously you are flipping the pages of your notes and while seeing the pages of your notes your image memory is developed your image memory is developed and this image memory is very much helpful in the examination yes so if you are doing the post exposure profile access for the rabies yes and if you are forget so what you do, you can do the Google, just type the Google, what is the post exposure profile access, but please stop. Do not do this mistake. You go to your PSM notes, your vaccination notes, your rabies notes, and open that notes and find that topic. So in this purpose, you are going to the same topic on the same pages again and again. So your visual memory is developed. Your visual memory is making strong. Yes, if you are doing Google yeah your image memory is not developed if you are taking so much screenshot in your phone yes so much screenshot are not getting to revise so your image memory is not developed obviously screen has no memory but this pages has a memory because these pages are stable these pages are stable but screen not is stable screen is changing very much frequently we can scroll the screen very much frequently than the scrolling of these pages so this thing for the दिस थिंग फॉर दी विजुअल मेमोरी सो यदि आप कोई टॉपिक सर्च कर रहे हैं तो उसको गूगल नहीं करेंगे उस टॉपिक को नोट्स में सर्च करेंगे जब नोट्स में सर्च करेंगे तो उसके साथ आपको काफी सारे चैप्टर और देखने में आ जाएंगे पेज पलटने में आ जाएंगे आपके नोट्स खुल जाएंगे कहाँ पे कौन सी चीज लिखी है ये पता चल जाएगा और जब आप उस नोट्स में से उस चीज को पढ़ोगे तो आपके दिमाग में उस पेज की एक फोटो छप जाएगी दोबारा फिर वही क्वेश्चन ढूंढना है वापस उसी पेज पे आएंगे वापस से वही पेज पढ़ेंगे तो इस तरह से आपकी एक अच्छी इमेज मेमोरी डेवलप हो जाएगी जब आपकी एक अच्छी इमेज मेमोरी डेवलप हो जाएगी तो कई सारे क्वेश्चन का आप आंसर ऐसे ही दे देंगे कि राइट में क्या लिखा था लेफ्ट में क्या लिखा था तो आंसर ये वाला हो जाएगा यदि गूगल करते रहेंगे स्क्रीनशॉट ले लेके पूरे फोन की गैलरी गैलरी भर करते रहेंगे तो आप उसको कभी रिवाइज नहीं कर पाएंगे। यूं भी जो स्क्रीन होती है उसका टर्नओवर टाइम काफी ज्यादा होता है, तो स्क्रीन से कभी भी इमेज मेमोरी नहीं बनती है। सो पहले वाले जो एस्पिरेंट्स थे वो बुक से पढ़ते थे, रिव्यू बुक से पढ़ते थे, उनकी इमेज मेमोरी अच्छी होती थी। आजकल क्या है, ये वाली पीडीएफ आई नहीं, दूसरी वाली पीडीएफ पे चल जाओ, तीसरी वाली पीडीएफ पे चल जाओ, तो उससे इमेज मेमोरी आपकी नहीं बनती है। यस, so Dr. Consistent is asking how to prepare FMG from your contents are all topic mnemonic and all. Yes. So if you are a FMG aspirant, the FMG and Neetpg are conducted by the same board, National Board of the Examination, and papers set by the same examiner. The examiner of the Neetpg and FMG is same. Only the topics is also same. Only difference in the pattern of the question or the weightage of the question. Topic is same, examiner is same. Yes, question is also same. But in NEET they may ask the long scenario. In FNG they may ask the IBQ only. Yes, so things can be interchangeably. NEET PG PYQ repeated in FMG, FMG PYQ repeated in the NEET PG. So we already did the last 5 year topics of the NEET PG subject wise in the super easy mnemonic from our topic group, so you can revise from there. Yes. Yes, Dr. Consistent. So the topic you are searching for the mnemonics we already done, because our M3 Academy content is derived from the MRC. MRC is mnemonic request centers where our registered member keep posting the content which they feel the forgettable volatile. Yes, if most of the aspirants are giving us such content, the requesting for such topics that are volatile, forgettable, if most of the aspirants are making that question wrong in their GTs, obviously we can make that question wrong in your GT, so we can learn from the mistake of the most of the aspirants through M3 Academy. Yes, so this mnemonic request center is a very smart tool that develop our team. Yes. Now, so next thing, so how to fail in NEET PG? So do not trap in the FOMO. Yes, one source for one subject for one topic. Yes, try to learn everything. Yes, if you are trying to learn everything, you will fail in any exam. Yes, if you are not practicing the MCQ, daily MCQ, you will fail the examination, because you are preparing for the MCQ test. And if you are only reading the theory, that is not beneficial for you. Yes, making the lengthy notes, obviously if you are making the lengthy notes you will not able to revise that, not able to give you any advantage. Yes, not analyzing the recent pattern year question. If you are doing the last 3 year ago AMS paper, yes, if you are practicing the 3 year ago AMS paper and exam pattern is just changes last year, the 50-50 set of the questions, yes, then obviously this is not helpful. So you have to analyze the recent previous year question. Yes, if you are not attempting the GT, yes, and you are looking the rank, but you are not looking at the mistake. Yes, most of the aspirant ask us, sir, my rank is not improving, but your attention should be the topics you mark wrong, that should not be repeated in next GT. Yes, so please put more attention in your mistaken topics than your ranks. Yes, so if you are looking at your rank but not looking at your mistake, you will fail in your examination. If you are searching solution for controversial question, because the searching for the controversial question take lot of time. In this time you can do your 5 PYQ. Yes, your two previous year topic, obviously you will get the advantage. Obviously you will not having the revision plan, so you will you if you are doing the randomly, you not having the revision plan, you will not get any benefit. तो यहाँ पे एक revision plan होना चाहिए. Yes, और डेली रिवीजन हर की बुक भी आपके पास होना चाहिए. ऑब्वियसली एडिक्वेट स्लीप इंपॉर्टेंट है. यदि आप सोशल मीडिया पर काफ़ी ज़्यादा डिस्ट्रैक्टेड हो रहे हैं, इंस्टाग्राम चला रहे हैं और कौन सी रील से कहाँ पहुंच गए हैं, तो काफ़ी सारा टाइम कब खराब हो जाएगा आपको पता नहीं चलेगा. यस, एंड इफ यू आर कीप डिलेइंग, आज का कल पढ़ लेंगे, कल परसों पढ़ लेंगे. यदि आपको पता है कि आईएनआईसीटी में इमरजेंसीज इंपॉर्टेंट है, नीट में एबीजी इंपॉर्टेंट है, और आप सोच रहे हो कि एग्जाम के लास्ट डेट में आईएनआईसी इमरजेंसीज पढ़ लेंगे या एबीजी तो बाद में कर लेंगे, सो ये सबसे बड़ी मिस्टेक है. क्योंकि जो टॉपिक्स है, हर साल क्वेश्चन आ रहे हैं, ज़्यादा क्वेश्चन आ रहे हैं, उसको सबसे पहले करना है. यस. यस. So if you already know the emergencies are asking in the AIMS examination, and if you are keep delaying that emergency topic, yes, so you doing the fail process, yes. तो ये चीज यहाँ पे समझ में आई. Now, so this is a cheat code for the MCQ solving. Never ever take any MCQ lightly. Yes, avoid overthinking, avoid underthinking while attempting any test. Yes, and you should think like the examiner. Why examiner are asking this question? In which way the examiner are going to trap us? Yes. Now read the option carefully twice. Obviously, focus on the keyword correct, true, false, and incorrect, and if there are the term like the absolute, always, near, 100% और 0%, this term ज्यादातर टाइम पे ये जो टर्म होती है ये यहाँ पे जिस भी ऑप्शन में ये होती है वो करेक्ट होने के चांसेस रहते हैं. यस. नाउ, so do not put your so much time on the difficult questions. Yes. So other thing we'll already discuss. Now, never assume any pattern. Yes, if you are answering, if you are attempting the GTs or examination and there is a two, three question has the C option, so do not mark the next question also C option. So do not assume a pattern. Yes, so आपको question पढ़ना है, answer पढ़ना है, उसी के according answer करना है. Yes. So every day once you start solving MCQ in the exam mode for the custom modules, ये आपको शुरू करना है. और every day if you are start doing the custom module, you will learn the art of the cracking MCQ based exam, reading the question, sitting capacity, guessing power, reducing the silly mistake, reducing the exam anxiety. Yes, once you start solving question on regular basis, you will able to understood and recognize the pattern behind the question. Yes, the and trend of the examination, and you will able to rule out the options and come out to the correct option even you don't know the right answer. Yes, if you want to develop a superpower inside you, that if you don't know the answer and you can mark the answer correct, so you have to follow this strategy. You have to keep solving MCQ daily. If you are keep solving MCQ daily, you will able to understood and recognize the pattern behind the question, recent trend of the examination. Obviously, you have developed the magical skill of the rule out the options. Yes. So even you don't know the answer, you can the answer. Obviously, contrasting options are answers. Yes. If one option is hyperkalemia, one option is hypokalemia. Obviously, examiner is trying to confuse you. So you can mark between the two options and your answer may be correct. Yes. Now, so once you know how to rule out the option, you will able to get the correct answer very easily, even you don't know the answer. Now, what is the Inicet injection? Yes, many of you are asking in comment section, what is the Inicet injection? So Inicet Institute of the National Importance, but in the M3 Academy, the full form of the Inicet is intensified mnemonics injection. Obviously, these are the sessions, these are the mnemonics video session that are conducted by the M3 Academy team. Yes, which are the selected topic in the depth. So we are conducting too many injection session, and we are taking the selected topic in the depth in form of the INICT injection. Yes. So this is booster dose for the INICT preparation and rank. Daily one shoot of the mnemonics injection we already done, and this is concise, high yield, previous year forgettable, volatile contents. Yes, and the recorded live audio, video, PDF already available on the registered members Telegram. Yes. So if you have any question, you can type in the chat box, or you can contact in the M3 Academy Telegram. Yes, hope this session useful. Yes. So if you like this session, please share with your friends, and keep studying, keep winning. Yes, all the best for your preparation. Yes. Yes, Dr. Consistent is asking कहाँ है sir playlist topics. Yes, so if you are going to the M3 Academy YouTube channel, there is a various folders like live, short, videos, and the playlist. If you are going to the playlist, and if you are going to the live, there are subject-wise playlist. And if you are registered member with the M3 Academy on the Telegram group, there is a topic group. There is a subject-wise folders. Yes, so you can do from there. Yes, if you have any question, you can ask in the chat box. Yes. So hope this session is useful for you. Thanks for the